Good morning. We are now having a new session, and this is about urinary bladder. And the issue is micturition reflex. Okay? I think you have covered the anatomy of the urinary bladder in your previous lectures. Great. And histology as well? Good. That will support. Great. Okay. We come across different experiences in urination. And you may have seen some cases as well, or heard about some cases. You have seen children, okay? Less than the age of like 2 years or 1.5 years, when they don't tell anything about their urination, they just urinate wherever they are, whatever they're doing. They don't bother, okay? They are free, basically, okay? Others have to care about them, the mothers have to care about them, but they don't actually, okay? It doesn't mean that they are abnormal, okay? It means they are attaining gradually some maturity in the process of their micturition. It means that these young children below the age of their toilet training, when they don't say anything that I have to go to bathroom, okay, they just don't give any notice and they just pass urine, okay. It means that system, their system at that time is not completely developed in the sense of control, and that control comes at a particular age, maybe the age of 2 years, maybe the age of 2.5 years, or like that. We know we all have passed through this process, and all the human beings, they pass like this, okay. So it means that process comes gradually. This is one thing. I'll give you a case. You haven't done the central nervous system, but you know about the spinal cord, okay. And spinal cord damage, especially which is very common here in Saudi Arabia. Why? Because of accidents, very bad accidents. It's a high-speed collisions because the speed of driving is very high. Okay, you have got perfect roads, highways, you drive, and unfortunately, sometimes you see accidents around. And when there is a head-on collision or there is a serious accident, what happens is that there is thrust to the spinal cord and it is damaged in a particular portion. If the spinal cord is damaged, then the process of urination is affected. Well, what happens? Yes, okay. It's a good word. You said incontinence. Do we know the meaning of the word incontinence? Okay. When there is no control over micturition, the voluntary control is lost. We cannot control it. It passes automatically. Okay. So this happens. A person develops a problem if the spinal cord is completely cut or damaged like this. It is broken, it's severed because of the vertebral damage. What do you think will happen? Will there be, if the spinal cord is completely cut in one area and there is no connection in the upper and lower part, they are just touching each other, but there is no connection. Now imagine. Do you think the messages are going to brain? Do you think the messages are coming from the brain to control? No. Okay? In that situation, the sensations of the bladder and the motor control which is coming from upper parts of the brain is no more. It's lost. Okay? If it is lost, still the bladder is working because the bladder control comes from the lower portion of the spinal cord. And if the damage is above that portion, okay, there is no two-way messaging. Khalas. But still the lower part of spinal cord is mawjood and it is living and it is controlling the bladder, but the brain doesn't know about the bladder, okay, and the brain doesn't control the bladder. That's the issue. Did you get that? In this case, if I am a person like that, maybe I am on the wheelchair because my spinal cord is damaged and my lower limbs are not working. I am on the wheelchair and I cannot move. It's shalal of the lower part of the body, okay? But I have no sensations of the bladder. What will happen? The urine will form, urine will fill inside the bladder, okay? But I have no feeling that I have no urge to go to the bathroom because I cannot feel. My brain is not receiving the message, right? So what will happen? The bladder becomes bigger and bigger and bigger, and there may be some dribbling of the urine because the pressure is increasing. Some drop by drop dribbling can occur in the full bladder. And sometimes what happens, because lower part of spinal cord is still there, all of a sudden there is contraction of the bladder and the urine passes. Whatever I am doing, I'm sitting or I'm lying on the bed or I'm doing anything, eating, I don't know, and I see that the pants are wet now because urine passes and I have no sensation, okay? This kind of bladder is strange really, okay? Sometimes there is dribbling of urine, drop by drop, and sometimes all of a sudden a reflex occurs, but that reflex doesn't come from brain. That reflex you don't know about, and that reflex is from the lower part of the spinal cord. Well, that proves that your spinal cord controls the urination, but upper part of spinal cord or the lower part of the spinal cord? The lower part. And this control is kind of independent of the brain in the sense that the reflex will be there, okay? The brain is not controlling or influencing it, okay? You'll have problems, but still the reflex is mawjood in the lower part of the spinal cord. This is one case of the urination problem, okay, which happens. I'll tell you more about that later in the end when we decide about the names of these conditions, okay? I'm just giving you the case scenarios. Number one, did you get that? You may as well have seen some persons, old age persons or the ladies especially. You know, ladies when they are in the reproductive years of their age, they give birth to children, okay? 4, 5, 6, 7, 8 children like this, okay? So mashallah, it's a big family. And what happens later, that sometimes the mother complains after giving birth to many children, okay? She has passed through processes every year or every 2 or 3 years, and obviously the system is mechanically stretched, isn't it? And the system comes back to the normal, but still the process of childbirth is not an easy process really, okay? It's a big challenge to the woman really, okay? And that's why Allah subhanahu wa ta'ala has given such a great honor to the mother, okay? Just because of that bearing of the child, it's not an easy, first keeping for 9 months and then giving birth to the child really, okay? Imagine. Anyway, the idea is that these women sometimes complain that when they have like cough, they feel that few drops of urine have leaked. They develop some kind of a weakness and they cannot have a very good control over the bladder, one condition. Or if they laugh or sneeze, okay, and intra-abdominal pressure increases. Because of the increase in intra-abdominal pressure, the bladder is compressed and probably their control sphincter is not working very well, and that causes the leakage of urine. Few drops maybe, or a little wetting, but it happens, okay? So the control is not perfect. Or whenever, if the bladder is filled and they are changing their position, in any case, if the intra-abdominal pressure is increasing, it's a chance that they pass urine, and this is distressing for the woman. This is incontinence again, and this also has a special name. We'll talk about that, okay? Coming to another case. A person has some kind of problem in the spinal cord region, okay? Not the damage like trauma, shadid trauma. Now, this time, there may be some other, a tumor or a compression or some problem inside the spinal cord in the region which controls the, sacral region, which controls the urinary bladder. You know that, mashallah. Great, okay? So, now what will happen? That the person complains about a different thing. He says that, well, it's embarrassing for me that all of a sudden I feel that I am in a state of like urination. I feel like urinating shadid desire to urinate, okay, as if my bladder is filled and I have to rush to the bathroom really, I have to run to the bathroom, and if I don't find a bathroom or if I'm late, no way, it's gone, okay, so it's leaked actually, okay, so in the clothes, so the control is lost, okay, and when the person goes to the bathroom and passes the urine, what? It's a little amount of urine which comes really, and that was giving such a strong sensation. It was not a full bladder, it was not a large volume of urine, but then it was such a strong reflex that he could not bear it. There is an urge to go, and it's an urge incontinence, okay, because of the emergency. The bladder is strangely not filled, but still there is some problem, and the person has to go again and again to the bathroom. And whenever he goes, he feels that it's not volume, it's only the reflex which was causing the trouble, and he could not have the control over that, okay. In some cases of the like diabetics or some persons who have the sensory nerves of the bladder which are taking the sensations, they are damaged, which are going to the spinal cord, okay. Now their motor system is okay, but their sensations are lost, so they don't feel about it. Even though they are not paralyzed, they have no problem. Spinal cord is also okay, but the sensory nerves which are going to the bladder, they are not working. If they are not working, then will they have the sensation? No, they don't have a sensation. Again, the bladder fills and fills. Naturally, what happens? Whenever we have a sensation, we know now it's time. We can still control that. We are sitting in the class, or we are in the room, or we are doing something. Say, let's khalas, okay, I'll go after half an hour, no problem. I'll go after 1 hour, I can control. I know that, okay. So when it becomes extreme, then we go and then we can pass urine. But we have a very good control over micturition, okay. Well, that person who has loss of sensation, what will happen? The bladder fills and fills and fills, and he does not have any sensation. So what will happen to the bladder then? Reflex can occur, but if reflex does not occur, then what is the second choice? He will, in what form? Usually, if the reflex is not occurring all of a sudden. In the previous case, when the spinal cord was damaged, the reflex was occurring all of a sudden, but then there was another possibility also. What was that? Some drops, dribbling of the urine. A reflex may also occur, but usually there is, all of the time bladder remains filled and he doesn't know about it. When the bladder remains filled and filled and filled, then there are chances of dribbling. But after years and years of problem, if you don't treat that problem, what will happen? The bladder, because of stretching and distension, will become bigger in size. And what will happen to the walls of the bladder? Thinner, because stretching and atrophy, thinner. That kind of a bladder shows a loss of tone, or the tone decreases. The tone of the bladder becomes low. Tone of the muscles of the bladder, it goes down really. So the bladder can accommodate large volumes and dribbling is there, but bladder becomes bad. Thin and atrophied bladder with a loss of tone, okay? So we talked about many cases, from the normal child who doesn't have a control. The control is abnormal at that time, but the child is normal. Everything, his system is normal. Okay? He's only waiting for the time, isn't it? So we'll come back to the cases, but did you get different presentations of the bladder problems? These are some common problems. There are mixed problems also, which are very complicated really. 2 or 3 cases are mixed together also at the same time. Okay? The process of micturition is the process of urination. Micturition is a special word that we use for, and it's a reflex. Reflex means it is controlled by the, not necessarily brain. When I say reflex, some nervous system circuit comes in your mind, some nervous pathway is coming in your mind. That could be anything, okay? It could be spinal cord, it could be brain, it could be both brain and spinal cord, or it could be outside as well. Sometimes sympathetic ganglia or parasympathetic ganglia are controlling. There are some reflexes. Reflex means something neural or nervous, some kind of a circuit which is there and it has a pathway, okay? We know the meaning of the reflex. It's an involuntary action which is happening, okay? in response to some stimuli. So stimulus has to be there and the response will come. And this has a pathway, and the pathway is a nervous pathway. So that's why you call it a reflex. Micturition is a reflex. Now, this reflex, as we discussed in the problems, now what is your idea? Is this reflex controlled by the brain or the spinal cord? Spinal cord. So it's a spinal reflex. Okay. Now, make a guess. Maybe you have done it in anatomy also. Do you think this reflex is a somatic reflex or the autonomic reflex? Both? When you are saying reflex, if I say dominantly, if you consider, which one would you like to say? Autonomic or somatic?
Somatic.
Some of you are in favor of somatic and some of you are in favor of... Okay, now get back to the case. A person, which we discussed, has a damage, severe damage in the accident and doesn't know anything about the bladder control, doesn't have any sensation. Is the reflex present there or no? Still. So does he have any voluntary control at that time? Somatic has a voluntary control, isn't it? When you say somatic, it means you're talking about skeletal muscles by which you can control or you can relax or you can control, isn't it? So now, getting back, what will be your opinion? Will it be an autonomic reflex or a somatic reflex? So it turns into autonomic reflex mode, right? You got it? Because if you have no control and your control is lost in case of spinal cord damage, your brain is not controlling your muscles, okay? And still the reflex is present, then it is something else. So it should be an autonomic reflex, okay? It will talk about a complicated thing, a somatic control over it. We'll talk about that inshallah. But it is an autonomic reflex. We call it, when we say a comparison, we call it autonomic reflex. Okay. If it's an autonomic reflex, will it be a sympathetic reflex or a parasympathetic reflex? Parasympathetic reflex, okay? That's great, okay? So we are now giving it a time and we are saying that we have a special spinal reflex which is parasympathetic reflex operating in the sacral region, and that is the urination reflex, the micturition one, okay? All right. It's autonomic spinal reflex. We are not doing that. All right. Okay. I'll not stay at this slide. I'll get back to it. But first of all, I'll just have a quick recap of what you had in the anatomy. I'm sure you have done this in anatomy, but it's a quick recap. The bladder. Think about the structure of the bladder. The body of the bladder, the neck of the bladder, okay, and the two ureters are opening from above, making an angle and passing through the wall and opening, and the urethra is starting from the neck of the bladder and then it passes into the genitalia, as we know, in the male or in the female. Okay. Now, special points about bladder. Very quickly recall. Where are the smooth muscles in the bladder? Throughout in the body and in the neck area, or only in the body? What do you think? What is your choice? Abdullah? Neck. Abdullah is saying neck. Do you agree? Okay. What about the body? The rest of the whole structure? Yes or no? Smooth muscles? Yes. Yes, you do. What is the name of that muscle which is there? Detrusor muscle. Thank you, Salman. Great answer. Okay. It's detrusor muscle. Okay. So detrusor muscle is a very unique muscle which is making, it's smooth muscles. It's making the bladder wall, basic structure of the bladder, and it's coming down to the neck of the bladder. But in the neck of the bladder, you have a special arrangement of the smooth muscles. And what do you call that arrangement as? It's the sphincter. This is sphincter. Now you've got two sphincters in the bladder. Please. Internal and external. Now this is sphincter which is made up of the smooth muscles in the lower part, in the neck area of the bladder, at the beginning of the urethra, just at the beginning, junction. Will it be an internal sphincter or the external sphincter? External? Internal. Everybody is agreeing on internal? Okay. So it is internal sphincter. All right? We have one rule in the class. Thank you. So, one more sphincter is left. What is that? External. Where is that? Yes. Further down, as the urethra begins, just outside that, now you have the external circular arrangement of smooth muscles? No. You are saying no. If you are saying no, then what? Skeletal muscles, the voluntary muscles, and that makes the external urethral sphincter. Very quickly now come to the innervation, the nerve supply, the connections. Okay. Now make a relation between the spinal cord and the bladder. All the possible relations that you can develop one by one. Number one, okay. What kind of reflex is it? To be very specific, parasympathetic. Thank you very much. Now think about parasympathetic. How can you make a relationship between the parasympathetic control of the bladder and the spinal cord? Of course, this parasympathetic is not coming from the brain. It's coming from the spinal cord, sacral spinal sympathetic parasympathetic region. Now, where is that region? Sacral. To be very specific again, where exactly? Sacral is S1, 2, 3, 4, 5. 2, 3 and probably 4 also contributing. Thank you. Okay. 2, 3 segments and the fourth one also to some extent, but 2, 3 are definite. Yeah. What else? Where exactly, in which part of your spinal cord levels are S2, S3 and S4? Is it in the anterior part of the spinal cord, posterior part of the spinal cord, or the lateral part of the spinal cord? Very quickly. Because I'll not really say that you would be knowing it very well because you have not done the sections of the spinal cord. The CNS is not done yet. But what do you think? The sympathetic and parasympathetic control, is it in the lateral part or in the anterior or the posterior part? Anterior? Yeah. Yeah. Yes? Yeah. Now, it's a good time just to remember one little thing, which will be a message actually of discussion. Anterior, posterior and lateral part of spinal cord. Okay? Anterior and posterior are the regular parts of the spinal cord. It means some regular features are there. Anterior is for the somatic motor control. Okay? Wherever you cut spinal cord, cervical, sacral, thoracic, lumbar, any area, well, it's a straight column of anterior present throughout, and that is giving you special neurons, the motor neurons, controlling the skeletal muscles. So anterior is for the skeletal muscle control, somatic control. Did you get that? Okay. Posterior is receiving the sensations from all levels of spinal cord, and all the somatic sensations and all of the sensations of the body are entering from the posterior side and going into the posterior horn of the spinal cord. So now posterior is confined to sensory. Now what are you left with? Lateral. Lateral is not a regular feature. It is present only in the specific portion for sympathetic. You know that. From T1 to L2 portion, sympathetic. And then again in sacral region, S2, S3 and S4. Khalas, that's it. That is it. So, lateral horn is a special horn which is present only in the T1 and L2 regions, T1 to L2, 14 segments, and then in the S2, S3, S4. For T1 to L2, will it be sympathetic or parasympathetic? And what about S2, 3, 4? That's it. Now you will remember the location. So, which part of the spinal cord or which horn of the spinal cord? The lateral horn. Don't forget that. Okay? Anyway, this is about the parasympathetic. Now, the sensations are going in the pelvic nerve, and they are going to which area of the spinal cord? Again, you will repeat. Specify the segments also, please. S2, S3. If you forget about S4, no problem, but don't forget S2 and S3. Okay? S2, S3, S4 segments of the spinal cord. Okay? The motor parasympathetic fibers are also coming in the same nerve, the pelvic nerve. Okay, and that pelvic nerve is very important. It has a very special name, and it's so famous you'll not forget it. This nerve is called nervi erigentis. Nervi erigentis also. Okay, because it also supplies some other structure. Nervi erigentis. Erigentis. Gentis means what? Genitals. Eri means what? No. E-R-E, eri. Think about genitalia and think about the word. Erection. Great. It means this nerve has a double function. If it is also going to the genitalia, what is it meant for? And you know parasympathetics will cause what? You know that phenomenon. You have done it in the foundation module, that stimulation of parasympathetics to genitals will cause the erection, the first phase of the sexual stimulation. Isn't it? So this nerve is a very special nerve. Okay, bladder control and also to the genitalia. Anyway, Shabab, so this is the parasympathetic circuit. Now you know parasympathetic reflex. The Merkaz is present in the spinal cord S2, S3. The sensory nerves, fibers are passing in the pelvic nerve, and the motor fibers are also passing in the pelvic nerves. This is called the pelvic parasympathetic nerve or the nervi erigentis. Okay? The second one, about the sympathetics. The sympathetics are also supplying the bladder. Now you can see sympathetics are coming from a source. Which part of the spinal cord? You can see it in the picture. It's the lumbar, it's not the sacral area, because sympathetics are present higher up. We just discussed from T1 to L2. So it should be coming from the lower part of the sympathetic, L1, L2, L3. All right? So the postganglionic fibers are coming and they're supplying, hypogastric nerves are there, and the hypogastric nerves are supplying and innervating the bladder. Okay? What they do exactly, we'll talk about that later. But this is the connection. So two connections are done, sympathetic and parasympathetic. First of all, getting back to parasympathetic. Parasympathetic fibers, when they are coming to the bladder, what are they doing? Where are they supplying? What is their function? Okay, we'll talk about function. First of all, where are they supplying? What are they doing in that sense of supply? What do you think? Sphincter and wall. Okay, that's a great answer. Sphincter and wall. Now specify, I would like to clear which sphincter are you talking about? Internal sphincter, because it's involuntary, smooth muscles, great, and it is the wall made by the detrusor muscle. Okay, so the main supply of parasympathetic, and that is the most important supply of the bladder. What do you think about sympathetic fibers? What do they do? If parasympathetics are supplying the wall and the internal sphincter, now let us think about the sympathetic fibers. They are also coming, they are also supplying, they are also autonomic, they have a different function, but where are they supplying? Same. Well, kind of same. Okay. Well, both sympathetics and parasympathetics are innervating that. The sympathetic supply is more coming in the lower part, okay, in the region where you have the trigone and close to the sphincter, the lower part, okay, but it is definitely there in the wall also. So answer same is a great answer. It's acceptable completely. Good. Very nice. Sympathetics, parasympathetics, now we are clear about their orientation. Where are they coming from? What are they doing actually? Not doing exactly functionally, but where are they going and supplying? Functions, we are holding them. We'll talk about the functions. Somatic, the last one. Do you think bladder has a somatic supply? Yes or no? Yes. But you are saying no. Why? Okay. But if you take this external sphincter, well, he was picking the word bladder, okay, and in that way he logically said no. If you are saying bladder, then it does not, okay. But if I say that region of the micturition process or the micturition apparatus, the whole thing, because it is not exactly at the bladder, it is at the junction, so he is not wrong also. In a way, we say that the bladder has two sphincters. It's a loose talk. It's the lower sphincter of the bladder. Because it is related with the bladder, we respect that and take it as a part of the bladder. But in fact, it is at the junction of the urethra and the bladder. Okay? In that way, you can say that. But still, we regard it as a part of the bladder. Anyway, so external sphincter, somatic supply. Anywhere else, or that is it? Somatic supply. Anywhere else, or looking at the wall, looking at the lower part of the bladder, sphincter, you are done. Do you have the skeletal muscles elsewhere in the bladder, any other area? If any other part of the bladder, except for this lowest part where you have the sphincter, do you have skeletal muscles? Yes or no? No. Okay. Be clear about your anatomy details. Okay. So be confident. If you're saying no, then be confident. If you're saying yes, be confident. Whatever. So yes or no? No.